Hi, welcome to Talking with Docs. I'm Dr. Paul Zalzal.
And I'm Dr. Brad Wheeling.
And today we are going to be discussing a very common injury, the wrist fracture.
Okay.
We've talked about this before. Fracture, break, crack, it's all the same thing.
It's all the same thing.
Not all wrist fractures are the same, but the word fracture, crack, break all means something's broken.
Usually happens when you fall, either from a standing height or a greater height, and typically a wrist into an extended position, but they're just about anything, or direct crush injury.
Sure, yeah, when you're falling, your reflex is to put your arms out, and that's what often leads to a fracture of the wrist, which is really a fracture of a distal radius. So
if I fall and my wrist is sore, what makes you worry about a wrist fracture? What other things do I have to worry about?
oh, well, if you fall, you have to worry about head injury, a lot of other things, or if you fell on the highway, a car coming.
I meant, so my wrist, I have pain.
Oh, right.
I have swelling.
Okay.
I maybe have some numbness and tingling.
Yeah.
I've lost my range of motion.
Okay, yeah, so sort of the signs and symptoms of a wrist fracture. Yeah, certainly pain, redness, swelling in the vicinity of the fracture. And what breaks, Brad?
So there's two bones approximately that make up your wrist. So your radius on the thumb side
here
is the big strong bone, and then your ulna, a long skinny bone along the outside. So more typically the radius is the one that breaks, but commonly the ulna can break as well, and often just a little tip of the ulna breaks. But usually it's the radius that we're talking about.
Yeah, a distal radius fracture. So it usually, we said, it occurs from a fall. Your distal radius can break. Signs and symptoms are pain, redness, swelling, tenderness, deformity. You might even see some deformity. You look down and your wrist no longer looks like it did 3 seconds ago before you tripped over your dog.
Weird.
So you go to the emergency room. How's the diagnosis made?
So like any orthopedic issue, you should the doctor will see you. They'll take a history. They'll do a physical examination. But the diagnosis is confirmed typically on X-ray. Very rarely, if you had an undisplaced fracture, they might have to do a CT scan. But typically, X-ray is how it's diagnosed.
Yeah. So you take an X-ray. It shows the broken bone. So I got a broken wrist.
So now the doc comes to you and is going to talk about either operative or non-operative treatment. Paul, how do they make that determination?
Yes, that's a good question. And I say that a lot. That's a good question. Whether or not you're going to require surgery depends on several variables. One, who are you? Are you a young, active, healthy person, or are you someone in your the older age group who lives a more sedentary life? Those are factors that are taken into account as to whether or not you are going to have surgery on your wrist.
Or a really high medical risk, potentially.
Right, if you're a high risk for surgery. Two, the nature of the fracture. Is it very displaced? So have the bones moved a lot? Is it very comminuted? So are there lots of little pieces of bones? And is there any step deformity in the joint surface?
Okay.
Those are sort of the main main sort of things that we look at when we're trying to figure out, oh, do we need to operate on this wrist, or can we let it heal on its own?
There's probably only one that has to go to the OR.
Yes. If
it's an open wound. So sometimes people use the term compound fracture when the bone has actually gone through the skin because of the risk of infection. Typically that's going to be brought to the operating room to be washed out, and then some type of fixation is going to be provided.
Why do you have to treat that so urgently?
Because the longer there's an open wound communicating with a broken bone, the higher the risk of getting an infection. And the amount of time between the injury to surgery is certainly debatable. For sure less than 24 hours. Some people say less than 8 hours, depending on the size of the wound, the conditions of the environment that might happen.
Right. So as quick as possible, we want to wash out that wound if the bone has seen the open air because you are at risk for infection. So that's very rare. More commonly, you have a closed injury where the bone has not breached the skin. So your surgeon is trying to determine from your X-ray and from you what kind of history you have, whether or not your wrist needs surgery. And I would say the majority of the time, the vast majority of the time, surgery is not required for a fractured wrist.
I would agree with that. I treat a lot of wrists non-operatively versus operatively. Totally agree.
Okay, so let's go. Let's talk quickly about the non-operative treatment. What is the non-operative treatment for a broken or fractured wrist?
So for me, it's a cast. If it's truly broken, rarely for me would a splint be my first line treatment. So it'll usually be a cast. Sometimes temporarily a splint will be used in the first week because of the amount of swelling. but usually it means wrapping the wrist circumferentially to help keep the bones immobilized.
I agree. And generally, the cast immobilization is going to be 6 weeks.
I would agree with that.
And then let's talk quickly about surgery. So,
oh, sorry, before we go to surgery, one thing I would say about the cast is that sometimes the bones aren't in a perfect position
Right.
before you have a cast.
Right.
So then you're going to undergo what's called a closed reduction, where sometimes a needle will be put in to freeze the wrist, or maybe you'll have some type of sedation, and then it'll be pulled on to try to make it look more normal or straighten it out, and then put a cast on,
Right.
which
So-
can be done in the clinic or in the operating room.
So the doctor is going to manipulate the bones to try and line them up more anatomically.
Okay.
Good point. So that's non-operative, and then quickly, operative management. Operative management basically means you're going to go to the operating room, an incision is going to be made in the skin, and then the bones are going to be put back where they're supposed to be, and then held there with
Probably 3 choices.
either a plate and screws, pins, or an external fixator. So some pins that come out of the bones with a bar across the top to hold everything in place. Probably now the most common thing would be plate and screws. However, historically, some things are in favor for a while, and then other forms of fixation become more popular.
Okay, so now regardless of the type of treatment you had, now say we're at 6 weeks and you've done an x-ray and the bone has healed or united, what now?
Now we are going to remove the immobilization to start some sort of physiotherapy or range of motion. After 6 weeks of fracture and immobilization, your wrist is going to be stiff and weak.
I'm not perfect after 6 weeks, okay?
No, you come out, it'd be very surprising to have you come out and be able to move your wrist perfectly after 6 weeks of immobilization. So you've got to start some physiotherapy to get your wrist moving and to get the strength back.
Excellent. A lot of people ask me, Paul, they say, well, can I just do the physio on my own? I'm busy, I don't have the money, I don't have benefits. Can I just do it on my own?
No. In a single word answer, no. You need the help of a physiotherapist to move things around, and they can also apply some modality treatment to take down the swelling and help with some of the discomfort that you're going to be feeling.
Totally agree. These people are experts, often went to 4 years of university to learn what they learn. I think the other thing that they can help do is push you, because sometimes when you're at home and you don't have time because you have kids or a job or whatever, you don't take the time for the wrist. And for any injury, there's a narrow and relatively closing window on the amount of time to get it moving. So I totally agree. I think a dedicated time for physiotherapy is critical.
Yeah. I mean, occasionally I do have patients say, oh, I just did it on my own, and they do okay. But generally, you should get the help of a physiotherapist. Okay, so now I've gone the 6 weeks of immobilization, whether or not I had surgery or not.
Yeah.
I've done the 6 weeks now of some physiotherapy and some strengthening exercises. About 3 months out from my fracture. Am I perfect? Am I good to go now?
So I think we've talked about in some of the other videos, I rarely use terms like perfect or normal, but that certainly is always the goal. But depending on the severity of your injury, there is a very real possibility that you'll have some permanent limitations, either subtle loss of strength or loss of terminal range of motion. For example, something called supination, where maybe you just can't get your hand all the way up, or you can't quite flex this far.
Yeah, well, let's go through quickly the range of motion that we look at in a wrist.
So there are 4 motions of your wrist. So flexion of your wrist, extension of your wrist, pronation when your hand's down, and supination when your palm's up. I always tell the kid fractures, I say, this is what you'd say, give me some money, Dad.
Yeah.
And if you can't hold it up, you can't take coins, so you can only take bills when you're like this. But
that's a good way to do it.
Coins, yeah, you got to be able to get up here, otherwise coins are no good, they fall down.
Tricky. Oh, by the way, what we're talking about now is adult fractures. We will have another video on pediatric forearm and wrist fractures, but now we're talking about adult fractures. So, yeah, those are the range of motions that we're trying to get back as close to normal as possible. And the other thing you might notice is deformity. You may now hold your 2 wrists out and say, oh, the one I broke doesn't look the same as the other one. Well, that may in fact be true, because the bone may be shortened, it may be angled a little bit, but it may be completely functional. It may not look exactly like the other side anymore.
Yep, I'd agree with that. I think the pain will gradually improve. Routinely for injuries, I say what you have at a year is what you're going to get, but the vast majority of improvement is going to come in the first 3 to 6 months.
Yes. And then the long-term things that we worry about with wrist fracture is post-traumatic osteoarthritis. You may have seen this in our ankle fracture video or other fracture videos. Whenever you break a bone at or near a joint, you're always at risk for developing post-traumatic osteoarthritis, which is arthritis in that joint because of the injury. Whenever you break a bone there, you damage the cartilage inside the joint, and in adults, that cartilage cannot heal or repair itself, so some damage is permanent in there. You may not feel it, you may be fine for 10 years, 20 years, or for the rest of your life. However, some people do go on to develop some form of stiffness and pain in the wrist after fracture.
Actually, I guess the one thing we didn't talk about is pain control after fractures. I'd say it's similar to other injuries.
Yeah.
So acetaminophen, anti-inflammatories, potentially narcotics depending on the severity, topicals.
Right. Agree. You may have heard some people say, oh, anti-inflammatories, don't they interfere with bone healing, like aspirin or something like that? Ibuprofen.
Yeah.
There is some, in our literature, we haven't decided yet. There's some evidence that says, yeah, anti-inflammatories can interfere with bone healing. Others say, oh, anti-inflammatories don't interfere with bone healing. Do you use anti-inflammatories after fracture?
I certainly do, because for me, I've been in practice 10 years now, and the number of times that I've seen a wrist that does not heal, to be honest, I think is zero. I don't.
It's very rare. They usually.
It's a forgiving bone.
That's a risk that it doesn't heal, but it is very commonly they do heal. Is there anything I can do to speed up my fracture healing?
So I'd say a couple things. People always ask me, hey, are my bones soft? Are they bad? If I have a whole bunch of milk, is that going to make it better? I say as long as you have a well-balanced diet that has an adequate amount of calcium, I think that's okay. One thing that has been shown to reduce healing time is therapeutic ultrasound, where you have a unit that is over top of the fracture and it sends an ultrasound wave to induce or turn on the bone-making cells to reduce healing time. So certainly there's some evidence
So
that
low-intensity pulsed ultrasound can help. And some of our colleagues are actually, I haven't really started yet, but some are prescribing vitamin D in a fracture setting, saying that vitamin D can help promote healing. And then on that note, what if I'm in my 60s or 50s and I had really a minor fall, and I didn't think my wrist should have broke because of that, but it did?
Well, certainly that's an indicator that you are potentially suffering from osteoporosis. And what I recommend to my patients, actually in our hospital we have someone from Osteoporosis Canada working with us, so you can be set up with them or see your family doctor to be assessed regarding the density of your bone and whether or not you need something like vitamin D or calcium or something more aggressive.
So definitely a wrist fracture is one of those fractures that can define osteoporosis. It depends on the sort of mechanism of injury, but it's something you should discuss with your physician if you do have a wrist fracture. It's basically wrist fracture, hip fracture, spine fracture, any of those three. Talk to your doc about whether or not you have osteoporosis.
I think that's just about it.
Thanks. If you have any questions,
please send an email to talkingwithdocs@gmail.com. We'll do our best to answer it in a timely fashion.
And remember, you are in charge of your own health.
See you next time.